Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Sonia Sloan. She's an orthopedic surgeon and she wrote the Kevin MD article, Think Again, Get a Second Opinion. Sonia, welcome to the show.
Thank you for having me.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, I am based out of Houston. I lived in Texas all my life. Orthopedic surgery, first Black female at Baylor College of Medicine. I do locums, traveling all over, multiple state licenses. Currently, for the past 5 years, been a contractor for Indian Health Services, Navajo Nation. Passion to do other things. So I have other serial entrepreneurship. We met before doing Rodox telemedicine, as well as I've written a book, The Rules of Medicine, and I do a lot of blogging as well. I have several nonprofits, Sloan STEM, plus arts, increasing minorities, having exposure to sciences. And then I have, kids that have busier schedules than mine. So trying to be present always.
Why is it important for physicians to have interests outside of their primary job in medicine?
Balance, man. We have to have balance. Currently in today's society, we definitely have to have it. I think when you and I trained, there was no 80-hour work week. And so there was no emphasis on lifestyle and quality of life. And so now things have changed and people have figured out that we can do things virtually in so many other ways, telemedicine and some other stuff. But the balance for our psychological stimulation and health is so, so important.
So you mentioned that you also do some locums and you work for Navajo Nation. So as an orthopedic surgeon, tell me what's that like?
It's interesting. You get to meet a lot of different people, a lot of different situations. You have to be sort of secure in who you are and what your skills are, your skill set, because you never know what kind of challenges you're going to meet. The Navajo Nation Hospital in Gallup, on the Four Corners, I see everything, massive trauma, which, Baylor College of Medicine trained me for, Ben Taub, our county hospital. But it functions as a level 3 hospital, but acts as a level 1. So again, you have to know what you're comfortable with and going into it. It gives you life experiences to travel, to meet other people, to see other cultures, to have some things that are outside the norm, humdrum of an everyday practice. So it's been good for me. It may not be cut out for everyone, but it's definitely an experience that I have loved.
And for those interested in pursuing some of those interests, like you described, working for Navajo Nation locums, what kind of resources do you recommend?
You definitely have to find the right company to work with. I'm with Comp Health. They're out of Utah. And there are multiple companies out there. Just make sure that you're getting what you really want. You can always negotiate. This is your time, your energy, your effort. So go for the times that you want to go, 1 month, 2 months, maybe 10 days, whatever. You pick and choose where you go and you tell them what you're willing to do. I don't want to do spine. I don't want to do massive trauma pelvises, that kind of thing. So those are the things that we're comfortable with, and you go in with that negotiation. So it's definitely, your call.
All right, let's transition into the Kevin MD article that you wrote. It's titled, Think Again, Get a Second Opinion. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so as you know, there's definitely some bias, medical biases and things that people don't, unconscious bias. And so what I see a lot of times is when patients come in, you have 3 generations, right? We have the generation, which I call the baby boomers of, tell me what to do, doc, and I'll do it. And you have the second generation that is the Google MD, WebMD. They think they already have their own doctorate kind of thing, that I'm going to do it this way. I just want you to sign off on it and write the orders. But you need the combination of both to have a great physician relationship. It's like, let you be educated as the patient, but also, take knowledge of what I have to offer and let's come to a happy medium. And so many times patients, and definitely this older population, they walk in, they take it for what it is at face value, and they do it, and they never question. And so there's a shift where people are now questioning what we're doing. There's many studies out there that basically the article talks about that says 1 in 20 will have some type of medical error, or, the fact that they didn't get a second opinion, something happens to them. So it's been called the 3rd leading cause of death in America, which is amazing. That was a study that was done several years ago by Mayo, and it surprised a lot of people to look at the medical error that happens and why. And again, in 1972, people were looking at it to benefit the insurance companies. Let's look at this and how can we stop people having procedures, surgeries, and having to have certain things done? We'll get a second opinion. Insurances thought that they were going to sort of get off, but what it showed was not only did people need the second opinion, that over 20 to 30% changed the diagnosis, that most people, 2/3, didn't even agree with the initial and the second opinion. So definitely get a second opinion, because we know it's the practice of medicine, right? It's an art form. And, there's standards of protocol, but there's also different ways that all of us are going to do different things.
So from a patient perspective, are there any type of cases that are more amenable to second opinions? And if so, what's the process of doing it? Is it as simple as just finding another doctor and starting from scratch again? So walk through the process.
Yeah. So you want to think, if you walk into an office and they tell you cancer, you walk into an office, I'm telling you, you have to have major surgery. You want to think second opinion first. Don't accept it at face value. Don't expedite because they're pushing you or they're rushing you. You have a little bit of time. I say that with a grain of salt. But let's say cancer, for instance. I've gotten a diagnosis of cancer. I probably may have known it or not known it, or whatever else. You could ask that doctor for it. I'd like to maybe be referred to someone else just to get a second opinion. That doctor should not be offended that you want to get a second opinion. They should encourage it, in fact, because it will either line up with what they've already found out and their game plan or their plan of action for the patient, but also to really benefit you as the patient. Secondly, you want to make sure that if it's something like surgery, I want to know who the surgeon is, what they can do, how comfortable they are with these type of procedures, maybe how many of these procedures they do. I'm not a hand expert. Can I do simple things? Yes. Can I do fractures, carpal tunnel? Yes. But major reconstruction, that's not my focus. So therefore I send it out. I get someone else to do a second opinion. So if your doctor is comfortable in doing that, you want to go that direction. If the doctor is very offended and taken aback, then your red flag should go up. Like, why are they so insistent that I'm asking for a second opinion? This is your body and your health. And so you have to stand up and advocate for yourself. Most insurance companies will, allocate for you to have a second opinion. They may fight you on it now, but most of them will allow that second opinion. And if not, it is definitely worth the money that you would have to pay, $150 to $175 cash money out of your pocket if you need to get a second opinion. Worth it.
Now, as you mentioned, medicine is an art. There are a lot of gray areas when it comes to diagnostics and treatment plans. What happens if you have two medical teams with different conclusions?
I think it comes down to that relationship, that patient-physician relationship. When you jive with someone, if that energy between you and that doctor are good. You have, and I call it Rule 12, there's an intuition that you just know that this is the person that I should go with. This is the person I'm more comfortable with. Either that doctor is taking time out to sit down and really talk to you, describe things, explain things, write out a game plan for you, or they may be willing to talk to you, let you settle with that new diagnosis or this plan of action, and let's come back and discuss it later on. So those are the things that you want to look for. If it comes down to A or B, who am I going to go with and what am I going to go with? If they're saying it's almost the same thing, go with who your gut, your intuition is telling you to go with, but more importantly, what you're comfortable and what you can buy into, because this is going to be a joint effort between you and that physician.
I'm seeing a lot of major academic centers commercialize second opinions. You pay hundreds of dollars and you get a second opinion. So what's your thoughts on those?
Two sides. I definitely understand the money side of medicine. I was on TikTok and said, what is the big thing that you really don't agree with anymore? And it's the financial side of medicine. It is a business, and we both know that. And so understanding where patients may not see it, like, oh, my doctor is going to care for me. The bottom dime dollar, what most of these companies are going to do is where they can cut, script, save, whatever, shortest amount of time, least amount of resources, that kind of thing. So when it comes to that, I still say go for what your gut says, put the money into it. It'll be worth your time, energy, your health.
And in terms of physician shortages, sometimes it's not as easy to find a second opinion, especially if you're in a rural area or an area where there's a lack of specialists. So what kind of options do patients have in those scenarios?
Yeah, and that's classic for where I'm at right now. We have to not only, the Navajo Nation has to be referred out. A lot of the cases that we send out, so you have to get a PRC, physician referral, confirmation. And so once that's finally approved, maybe about 5 days, then you can go and see this other doctor. That doctor may then decide to get their own x-rays and decide their own surgical plan. And then what if you don't even jive with that doctor? They have to start the process all over again, which for a fracture or a cancer or something else really sets you back in time. I do tell those patients, you can go someplace else. You can then later submit to the insurance. It may be out of, their insurance coverage or whatever else, and that may be even out of state. But most people, specifically if it comes to their children, they'll do that because it's worth that for their lifestyle, for their quality of life, for their peace of mind.
We're talking to Sonia Sloan. She is an orthopedic surgeon. She wrote the Kevin MD article, Think Again, Get a Second Opinion. Sonia, what are some take-home messages that you want to leave with the Kevin MD audience?
So one is speak up for yourself, be your own advocate. As a patient, we walk into doctors' offices and we're intimidated. This is your body, this is your life, this is your health. So therefore, speak up for yourself. Take someone with you. Right now, of course, with COVID, you can't always take a patient, family member or somebody else in. It's almost like you get your own second opinion by whoever's with you, the spouse, the friend, the mother, whoever it is, and says, yeah, I listened to what the doc said. It was actually good. I think what they said was great. Or you'll get the other ones and say, like, they weren't, that was crap. It's like, you don't have to talk to this person again or whatever else. And I hate to say it, but it does happen. It really does happen. So speak up for yourself, advocate for yourself. And then secondly, educate yourself. We talked about Google MD and WebMD. There's so much information out there. It is perfectly fine for you to come in with what information you have sought out, what you have, what questions you may have. And then I tell patients, definitely come with your question list. No doctor should be intimidated by answering all your questions. And then if time is an issue, when you call and you make that appointment, it was like, this is a second consultation, or this is going to take a little bit more time because I do want to speak to the doctor. Let them know whoever's booking that time is not a 10 or 15 minute window. This is going to be a 30-minute window kind of thing. So those are the things I would tell patients to do. And then again, never feel intimidated to want a second opinion for yourself. Again, go with your intuition. If it's not right, if it's not comfortable, if you have other people in your ear that are saying something is not right here, go with that, listen to that. I was watching Chicago Med the other day, I think it was Tuesday night or whatever, and they basically were 2 cases that were wrong, misdiagnosed over years. And so some patients get comfortable with that diagnosis because it becomes an identity for them. And so you also want to challenge yourself of saying, I'm the patient, is this right or wrong? And what may benefit could I have in exploring a second opinion that could help me long-term?
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.